Hello, my name is Lorraine Bonkowski, and I'm a registered dietitian at Michigan Medicine's Hepatology Clinic. In this video, we will discuss an appropriate diet for patients with non-alcoholic fatty liver disease, also known as NAFLD. The number one treatment for NAFLD is lifestyle modification, specifically working on changing diet and exercise habits. Most patients with NAFLD require some weight loss. We recommend aiming for about 10% of their current weight. So for example, someone that is 250 pounds would aim for 25 pounds of weight loss. Gradual weight loss is recommended. Usually about 1 to 2 pounds per week is normal weight loss, so avoid very restrictive diets or crash dieting. It is also recommended to avoid alcohol. One of the most helpful diet changes for NAFLD is to reduce the amount of starchy carbohydrates you consume, specifically refined carbohydrates, as well as limiting added sugar. Refined carbohydrates include foods such as white bread, white rice, and white pasta. Better choices would be whole grain bread, brown or wild rice, or whole wheat pasta. Added sugar can be found in many different foods. Obvious sources include candy or desserts or sweetened beverages such as pop. Less obvious sources might be yogurts, cereals, granola bars, salad dressings, and condiments. Women should really try to stay under 25 grams of added sugar per day, and men no more than 36 grams. Nutrition facts labels will show you how much added sugar is in a food. Also be sure to avoid a specific type of sugar called high fructose corn syrup. This is often found in pop, yogurts, ketchup, barbecue sauce, and many other foods. Read ingredient labels and look for this ingredient. A helpful tool for following a healthy diet and limiting the amount of carbohydrates is following the MyPlate guidelines. This is an easy way to visualize if you have the right types of food on your plate and the right amounts of food on your plate. Try to follow these guidelines for every meal that you eat, whether it's breakfast, lunch, or dinner. On the plate, we have 1/4 of the meal as protein, 1/4 of the meal as grains or starches, and then the other half of the plate should be vegetables and or fruit. Just keep in mind to have more vegetables than fruit throughout your day. The best overall diet that we recommend for NAFLD is a Mediterranean diet. This diet includes lean proteins such as poultry, fish, beans, and lentils, whole fruits and vegetables, whole grains, and healthy fats such as nuts and seeds, avocados, and olive oil. This diet is very low in saturated fats, which include butter, whole fat dairy products, fatty meats, and processed meats. Also, this diet avoids trans fats, also known as partially hydrogenated oil. The important thing to know about a Mediterranean diet is that it's very low in processed and packaged foods and really focuses on fresh and natural foods instead. Exercise is another important component of working on weight loss when you have NAFLD. Minimum exercise guidelines are 150 minutes per week of some sort of moderate intensity activity. You could break this down into 30 minutes, 5 days a week, or aim for 10,000 steps per day. Both cardio and strength training exercises are helpful with weight loss. If you have more questions regarding an appropriate diet for NAFLD, consider making an appointment with a registered dietitian. We hope that you enjoyed this video.